Good morning, good evening, good afternoon, everyone. This is Amy Cunningham. I'm coming to you from the United States of America. I'm the chair of the World Eating Disorders Action Day, which, as everyone knows, will be on June 2nd this year, the 5th year running. This is the third interview in our interview series this year, and we're super excited to have Dr. Eric Van Furth with us. Eric is a clinical psychologist and family therapist. He's the director of the Rivierduinen, and I'm going to let him pronounce that. How is that pronounce that, Eric?
Rivierduinen.
Rivierduinen Eating Disorders organization in the Netherlands. And he's also a professor of eating disorders at the Department of Psychiatry, Leiden University, also in the Netherlands. I've known Eric for a couple of years now because he was super excited about the engagement of activists early on in the social media space and was doing a lot of work in that area already. And I'm just thrilled to be able to see you, Eric, even in this lockdown. So welcome.
Thank you. It's great to be here. We had a very nice and sunny day here today, so it's good.
Awesome, great. Eric, we're just going to jump right in. Can you tell us, throughout your career, how have you seen the different treatment approaches change?
Well, I've been very lucky because I've been in this field, in the eating disorder field, for 35 years now. And it's changed a lot, I think. And essentially what I've seen change is that it used to be a very top-down behavioral kind of program. Classical behavior therapy where people were sort of locked up and had their way out of inpatient treatment was still very common when I started. And luckily I started in a family therapy unit. So family therapy has always been on the forefront of what I've been doing. And of course, what I've seen change in many ways is that the evidence for certain treatments has emerged, which I think is great because we need more evidence-based treatments. And I've also seen treatments become more personalized and more equalitarian in the sense that we are working far more with people with a lived experience. We try to tailor our treatments within the evidence base to fit individual needs and family needs as much as possible. And I'm super enthusiastic about what we've been doing the past 5 years, which is outpatient multiple family therapy groups. And essentially perhaps that's even a big change that I'm almost forgetting, is that we've moved from residential treatment to outpatient treatment for so many more people. So we've decreased the number of beds, and we're treating 90% of our patients as outpatients.
I would say that is a huge shift, definitely. As a person who had an eating disorder as a child and then struggled with it for many years, when my daughter developed anorexia, of course we know about the genetic links now, it was 100% outpatient with her. And can you talk a little bit more about, for lay folks or folks who are not familiar with it, what does that outpatient family treatment look like? If I were walking in the door with a, say, 10, 11, 12-year-old child, girl or boy, because we know boys, a third of eating disorders, folks are boys, affected by eating disorders are boys. What would that look like for me as a parent?
What it would look like is that we would ask you and motivate you to participate in a group with, say, 8 or 9 other families for a period of approximately 16 days extended over 7 months. And we'd start off with 4 consecutive days from 10 a.m. to 4 p.m. And we would work very hard on 2 things, is increasing the collaboration between parents and child. That's number 1. And number 2 is trying to figure out ways, have the families figure out ways in which they can manage the eating disorders and start changing behavior towards health. And of course, in many cases, that would mean stopping of compensatory behaviors and binge eating, and working on increasing meal size to achieve a weight gain to a normal level. And that's really the aim of the first 4 days, is really trying to get that done and getting it started, but in as much of a collaborative way and a way that's tailored for that specific family as much as possible.
That's great. And I imagine it has, well, I know it has far lower cost to the healthcare system as well and to individuals.
Yes.
Great.
And the nice thing is, of course, is the idea is that people take the treatment home.
Mm-hmm.
So parents and child actually start working on the treatment when they're away from our hospital. And that is such an advantage over having people come in as inpatients or residential for
Right.
residential treatment, in which the chances of actually the things people learn in treatment transferring from hospital to home, the chances are slim. And it's so much the advantage of having parents and child work on recovery at home are great.
Wonderful. We've heard that also echoed with the last two interviews with James Locke and Ellen Rome. We're talking to a few other folks as well, and it's really interesting having the perspectives, and great to see that there's this sort of unified move toward, as it should be, evidence-based treatment.
Yep. No.
Eric, can you have researched this whole issue of these pro-anorexia coaches, which is just a shocking thought. Can you tell us what this is and how it imperils eating disorder treatment?
I've been interested in how we can use the internet and web-based interventions to reach far more individuals, and I'm sure we'll get back to that later. But the ProAnaCoach research was sort of a spin-off in that some journalists wrote very brief and superficial articles on this topic, and I was involved in a criminal trial against someone who presented himself as a ProAnaCoach, and he was convicted. And so together with an organization called the Center Against Child Trafficking and Human Trafficking, we used various methods to find out if ProAnaCoaches was actually a thing, how many people were out there, how easy it would be to get in touch with them. And we also we surveyed individuals who had experience with ProAnaCoaches. And much to our surprise, we found out that we put out 3 fake profiles consecutively. We just posted a very simple message on the ProAna forum. I am a name and I'm 14 years old, underage. This is my height and this is what I weigh, and I would like to get thinner. Can you please help me? And within 14 days, we had been in touch. We had conversations online on a social media platform with more than 50 coaches.
Wow, that's shocking.
Yes, we were shocked too. And most of these coaches appeared to be men who were after at least nude photos, if not they were after actually getting to meet this young girl, underage girl, in order to have sex.
Wow. So it's it's really a criminal issue, and preying on such a vulnerable population as well.
Yes.
And what did your research? It sounds like you were effective in getting somebody convicted, which is great. How prevalent is it? Or can we assume it's that prevalent everywhere across the world? And how can families and
I'm sure it's very prevalent, and the internet has made it much easier for individuals who are looking for sex with underage girls even to get in touch and to prey on them. I mean, in the old days, they had to stand outside the school. Now they can simply troll the internet and do that in a very easy way. So I think this is an international issue. I'm sure it's an international issue. We don't have a clue as to the size of how many of these coaches are there. There's a flip side to this as well, because the individuals actually seeking a coach are generally, at least we spoke to, we surveyed about 80 individuals and had interviews with about 14. These individuals generally have anorexia nervosa or at least want to be thinner. And it's they actually seek a coach. So they would advertise, they would put out this ad saying, I need a coach. And which is, of course, illness driven behavior.
Right.
And once they'd done that, in general, the women we spoke to were very ashamed of their behavior, would not talk to anyone about this. This would be a big secret. And once they got in touch with a coach and they had transferred pictures of themselves in underwear or nude pictures, quite often they would be blackmailed. So this is a whole a criminal loop that they would get into while being very, very vulnerable.
What kind of advice could you give parents or relatives or friends of someone getting into this? Well, with an eating disorder, first and foremost, or any kind of behavior.
Yeah. Well, and clinicians, because I don't think clinicians, I don't think that in general that during a first assessment that we spend a lot of time talking about what people do on their phones and what apps they use and what sites who do they follow, what influencers, who do they follow on Instagram, what do they do on TikTok? You actually need to ask. I now spend quite a lot of time at a first assessment talking about this kind of stuff.
Yeah, important.
And of course, parents should be doing the same thing. Ask your child, who are you following? What do you, can you show me? Are you just following friends? Do you post or do you just lurk? You need to know as a parent, and in order to see if your child is safe and if the use of apps or internet is not harming instead of helping towards recovery.
Emma and I are just nodding because we took social media away for her when she was 11, 12, 13, just for that very issue, and she experienced some of those sites. Yeah. Well, Eric, we mentioned earlier before we started the interview a little bit about COVID-19. Can you talk a bit about how COVID-19 has impacted treatment for eating disorders?
Well, we've just finished the first phase of a study looking at the impact of COVID-19 on people with eating disorders. And this study was initiated by my colleague and friend, Cindy Bulik from UNC. And we now have data on approximately 1,000 individuals. And as was to be expected, COVID, of course, influences us all. But it's specifically, it has a pretty strong and clear impact on individuals with eating disorders. And there's so much to be said about this that I would really recommend for you all to read our paper, which is currently in preprint on a site called medRxiv, which is spelled very strangely, but still, and we hope and plan to publish it in a scientific journal shortly. But and we also plan to follow up these individuals for the next 12 months to see how the changes in all the government regulations on us, how they influence individuals with eating disorders.
And we'll put the link, Eric, in the post when we post the interview so folks can have a read that themselves. We're actually almost out of time, but I wanted to just get your thoughts on the theme of World Eating Disorders Day. And there were sort of two prongs to it. One was eating disorders can't afford to wait, which was our theme last year as well. And we thought it deserved 2 years in a row. And then also the sharing of personal narrative or experience. Just could you give us your thoughts about either or both of those?
I'd like to do both. I think.
Okay. Please do.
Well, early detection is one of my hangups. I mean, the major problem for individuals with eating disorders around the globe is still getting access to treatment. In many countries, there is very, very little specialized care. And in countries with specialized care and with good quality care, early access is the big issue. So how can we, together with families, cut down barriers for individuals to come in for treatment much sooner than we do now? And that would save a lot of suffering. Individual suffering, family suffering, and it would save costs because you probably need smaller interventions to get someone back on track towards recovery. So early intervention, early detection is a big thing. And sharing, the other theme, sharing your story, I think is extremely important. I think I've learned a lot by listening to patients, by listening to families. I think we should all take parents very, very seriously. They know their child much better than we will ever know. When we see a child with an eating disorder, he or she's ill. We don't know what he or she is like before the illness. So we should listen very carefully and help families make their plans in trying to get their child back to recovery. Vice versa, I think it's important that families listen to us as well. There's a lot of knowledge about how to treat eating disorders, and a good collaboration between parents, child, and treatment professionals is essential in getting someone back on track. So it goes both ways.
Right. It needs a team approach, for sure.
Definitely, yes.
And Eric, we're out of time. I think we could talk all day, especially with that lovely background of the forest that you. So we're going to add the link to your new paper and also your contact information in our post when we'll put it out later tonight. And really, really thrilled to speak with you, and stay safe, stay home, and we look forward to seeing you on June 2nd.
Yes, have a great World Eating Disorder Action Day. Thank you very much, Amy.
Thank you so much.